The first thing I'd like us to know about is corona. Corona means crown in Latin, and the term came about from the view of the coronaviruses under the microscope. Coronavirus is a group of a large family of viruses which have always existed, but the particular strain responsible for this outbreak is called SARS-CoV-2. So that's the official name of the coronavirus strain causing the current coronavirus outbreak. And the disease caused by this infection is called COVID-19. So the name of the virus is SARS-CoV-2, and the disease it causes is COVID-19. Okay, maybe before I talk about the science, it would be good to talk about the modes of transmission of these COVID-19. The first one is direct transmission, which can occur when one touches a contaminated surface or skin-to-skin contact. So the contaminated surface could be the skin of someone or another surface such as a table or a chair or a door handle or a sink. The next one is droplets. Droplets infection. Droplets are the moisture that we produce when we talk, cough or sneeze. So these droplets usually carry certain organisms, and in this outbreak, droplets are a very important means of transmission, because when we talk or sneeze, and if we have the virus and we are shedding the virus, then it can actually be in the droplets, and when the lamp surfaces, then someone could then touch them, and that's how the transmission goes. The other means of transmission are indirect transmission, where we touch what I can call a vector. A vector is another organism which may be carrying the infection or whose surface may harbor the infection. We also have what we call vehicles. Vehicles are not vehicles like we know them, but they're actually other substances. For example, the surface or tissue that has been used by someone who has it. If it's contaminated and someone touches it, then we can term that vehicle transmission. And recently they are also describing another mode of transmission, which is called microdroplet nuclei. Microdroplets, which may warrant one to think that it's an airborne infection, because these microdroplets are very light particles which do not land on the immediate surrounding of someone who produces them, but can be carried by air to wider or further distances from the person who produces them. The clinical manifestations of this condition are there are three major manifestations which have been seen more often, and there are other manifestations which are less common. And it's important for us to know that not everyone will manifest these conditions. People are different, immune systems differ, and so for some reason that's not yet understood, some people may actually have the infection but they never produce any of the symptoms, or produce only some of the symptoms. So the most common three manifestations that have been described are fever, cough, which usually starts as a dry cough, meaning that you don't produce any sputum, and then maybe subsequently one can start producing sputum, and breathing difficulties. So these are the three most common manifestations that have been described, but there are others like diarrhea, or tiredness or fatigue, sore throat, and loss of smell, which has been described in some patients, and in some patients the loss of smell has been the only indication that they might have been infected with SARS-CoV-2. Until recently, there haven't been any specific treatments that are targeting it, and the first rule of managing patients with confirmed or even suspected cases is that we have to separate them from other people. We have to, of course, the terms now will apply. If they are just suspected to have it, then we have to keep them in quarantine, or if they have it, we have to isolate them and watch, because for those a great majority of people may not show any symptoms, and so you probably not do anything apart from isolating and watching them. For those who tend to develop worsening of symptoms of cough, fever, and difficulties breathing, we do what we call supportive management. That is providing, for example, oxygen to help them if they cannot breathe very well. When they are unable to breathe on their own, we can provide ventilators, which are machines which help people to breathe. We also, of course, we can treat the fever and any other conditions which arise